Welcome to the session 1 of the Introductory Monitoring and Evaluation course that was created together with Salanga and British Council for International Cooperation. My name is Jakub Nemec and I'm the Program Director at Salanga organization working with non-profit sector on building their capacity and providing consultancy in monitoring and evaluations, climate change resilience and maternal child health. We also created tool called Kinaki. That's why you see the logo on our slides. And this tool helps organizations to streamline their M&E, create automated reports, and organize their monitoring data. The purpose of this session 1 is kind of really providing the introduction to the monitoring and evaluation systems and to clarify some of the terms that you may use or you may hear related to the M&E. The first slide I would like to point to the M&E concept. And as you can see on the slide, usually it's the case that we get the funding for the project and now we start to decide how we are going to measure and how we will know that this project has the impact we hope, we wish it's going to have. It is a little bit too late to start designing your M&E at that point. Ideally, we should try to create, to build the M&E concept directly into the design of the project, because we strongly believe that the M&E should really go hand in hand with the design and implementation. On the other hand, it's never too late, and it's better to do something now when the project was approved rather than any time later. So maybe to clarify a couple of things. Why do we even care about M&E? I think that's very clear. We need to be able to prove to the donor, but also to our beneficiaries that, or to the recipients of the project, that the project has the impact we promised to have. And at the same time, we need to also be able to measure or track that we are on the right track throughout and during the project life. We need to be able to see that the activities we do directly link to the higher level impacts and achievements that the project aims to have. In many cases, you hear about monitoring and evaluation, so let's just put some clarity to that. What's the difference between monitoring and evaluations? There are many definitions, and it's actually throughout this whole presentation we will be talking about many definitions, but I will just try to make it simple so for us to have some basic clarity without going too deep into definitions. For monitoring, it's a participatory ongoing project management tool helping us to identify if the project is on track or not. It also helps us to identify if we are meeting the objectives and the targets of the project. For the evaluation, that's more like an assessment of the project achievements, and we try to look at the achievements through several lenses. In Canada, commonly used lenses could be efficiency, effectiveness, sustainability, or relevance. Different donors may have different requirements in terms of evaluation. Sometimes you can hear that evaluation is called more the level of the survey. But throughout this course, I will be using monitoring, really covering all activities that are looking at the sort of achievements throughout the project, while evaluation is like one-time event, either in the midterm of the project and then at the end. So what is the M&E concept? It's a rough idea. We can call it also framework. It's a rough idea which tells us what kind of data we want to collect, why, and who is going to be responsible for that. It's not as detailed as M&E plan, but it gives us the rough idea. Let's say that we know we want to use a household survey, we know that we want to use focus group discussions, and we understand why each of these components of our M&E will be used. We also may include some sort of activity tracking and other components. So it's really just a rough idea of having understanding why and how the monitoring will be done throughout the project. Talking about M&E system and kind of deciding how is it different from the M&E concept, I would like to bring attention to this kind of definition. Think about M&E system as all components that you want to use. So everything we defined in our M&E concept or M&E framework, we kind of want to use in our system. So it's just really a sort of set of all the tools in our toolbox that we decided to use. What is kind of critical for an M&E system usually is not a term that would be described somewhere. It's just for us to have the idea. And when we talk about M&E generally, or we can call it M&E system, there are a couple of key points that I would suggest that we should really keep on top of our minds designing the M&E. Basically, we want to keep our M&E to be very simple, very participatory and people-centered, accountable, providing clear results, and also allowing for learning and encouraging for improvement. Now let's look at each of them a little bit more in details. Simple. If more complicated your M&E system becomes, more tools you use and more documents you provide, more templates, then less likely it will be integrated. More likely it will be a burden that your field staff will have to spend lots of time to actually fill all the templates and provide everything. At the same time, we have to balance it, so we should try to stay as simple as possible while responding to all the needs and all the requirements. That's why I would really suggest that the M&E system should be ideally discussed at the design stage of the project together with the entire team. So not only by the M&E officers sitting somewhere in a nice and warm office, but also talking about it together with the field staff and PR people and finance people. So we all know, we all have the same understanding what is realistic, and we should try to cut it as less as possible while fulfilling all the requirements of the donors. Participatory and people-centered. Why? We believe that the M&E systems that are currently used in many projects are far from being participatory. Even we call them as a participatory. I would say that as a rule of thumb, whenever you have difficulties explaining results of your surveys, of your activity tracking to the community, your system is probably not people-centered and participatory enough. So every time we collect any data and we do a project monitoring, we should be able to come back to the community and be able to explain what we have learned about the community. Sometimes that requires finding different approaches and different methods, but we need to find a way how to make this. If it's not happening, people cannot participate in the monitoring and measuring of their own achievements. And I think that's where we fail. The M&E system needs to also be accountable, which means that it needs to provide very clear results to the donor, and as I mentioned before, also to the community. And in any M&E systems, or let's say in any project, we may make failures, we may make mistakes, and we should be able to learn from these mistakes. The design of the M&E system should help us and should be accommodating and kind of open enough that we can actually encourage the improvements and learning from the mistakes and issues and challenges, but also from the successes that we had in the project. Everybody who joins the work of monitoring and evaluation will at some point hear about theory of change. In Canada, theory of change is part of the bigger picture, which is called RBM, results-based management. That's the approach which is currently promoted by the Canadian government, but also by many other governments and donors around the world. Within the theory of change, we have, I would say, 4 more categories. Again, this can be different for different donors, but what we usually see is these 4 categories. The first stage is where we are right now, which means we try to identify challenges that are existing in the community that the project is going to target. this may be either a problem tree, there could be a different tools to use this, but problem tree is one of the easiest example that we can actually go through, and we will get into it a little bit more into details a little bit later. The second stage is defining where we want to be, our goals, the achievements that we expect the project should have. That's the logic model. That's when we take the problem tree and try to flip it into sort of positive, finished statements. The third stage is how we are going to get there, measuring the journey, being able to define how we are going to get there, and that's the project implementation plan. And now that comes together very closely with the stage 4, and that's how we will know we are on the right track. And that's basically where the performance measurement framework would come in. Now, this sounds really difficult, but we will dive into it a little bit later, and you will see that it's actually not as difficult. Basically, what the PMF is taking your logic model and assigning to each output or each result that we expect to achieve during the life of the project or to contribute to, assigning a specific indicators, so which helps us to kind of measure how we are really doing. So let's now dig a little bit deeper into it. I mentioned that the first stage is a problem tree. I'm pretty sure that during your life you may see, you have probably seen something as a problem tree, even you may not necessarily know that it was a problem tree. It's basically when we go to the community, and ideally this should be done in a participatory way, that we actually involve the community to actively create the problem tree. In many cases, it means that we need to work in each community, and each community will be slightly different, because each community may have different problems or key issues that or challenges they face too. And then we try to aggregate it into sort of one covering problem tree, which covers all the major problems across the project area. But let's take an example here, as we came to the community, and it seems like that the main issue is the chronic malnutrition. It could be also stunting, and in the community, and we know that the community has really high prevalence of the chronic malnutrition. Now, to simplify this, we made this problem tree very simple and much more simplified. It would have many more issues and root issues, but for this case, let's just work with this simplified problem tree. So by discussing with the community, we kind of could find two main causes of the prevalence of chronic malnutrition. And one is that people have poor diet, either all year around they eat just rice, for example, or there may be a seasonal really lack of nutrients. But at the same time, we also figured out, maybe based on some medical trials or other ways to identify this, that people also have really poor absorption of the nutrients. So that means they are able to find a good food, but maybe because they are sick and then their stomach is chronically sick, they're not able to absorb these nutrients. Each of these causes will have some root causes, which means the issues which are out there in the community that we will try to address. So in this case, for the poor diet, we can look at the limited access to nutritious foods. We can also look at the lack of knowledge of nutrition, about like a nutrition, let's say lack of knowledge about how to prepare good foods and stuff. At the other side, for the poor absorption of the nutrients, we can look at some causes like poor quality of water or inappropriate sanitation. So this is basically a very simplified problem tree for the chronic malnutrition, and we will try to see now how can we actually work with this simplified problem tree throughout the project. When we look at the logic model, basically we take the problem tree, if we spend the time and have done it, and we try to flip potentially all the steps or all the levels into a positive statement. Basically, in a statements which are completed, which show us what the achievements of the project should be, where we want to be at the end of the project. So as you can see, our biggest problem that we wanted to address was a high prevalence of chronic malnutrition. So in this case, we try to create it into the statement that we will decrease the prevalence of the chronic malnutrition. And because the statement should be finished, it's really a decreased prevalence of chronic malnutrition. We also want to improve diet, so the diet will be improved at the end of the project. Now, with this being said, based on the donor, we may want to include many more other things in these statements. For example, we want to reflect the gender equality, the environmental sensitivity, or any other aspects that may need to be necessary to actually achieve the results for everybody. Okay, so let's dig a little bit deeper into the M&E. So in the previous step, we talked about the logic model and we defined the results of the project, what we want to achieve, where we want to be at the end of the project. Now, it may be for us a little bit unpractical and I would say almost impossible to just wait for the end of the project and then be hoping that the achievements will be there. To be honest, I still see it in many projects, many organizations rely heavily on this, and I feel it's actually almost a crime, I would say, against people, against the recipients of the projects, not having any proper place, any proper system in place that can actually help us to understand where we are at any point of the project. So that's where the performance measurement framework, PMF, as a part of the results-based management, comes really handy in place to give a little bit of system and to give us some milestones that we want to achieve and sort of helps us to navigate and measure and track where we are in the project achievements. So as you can see in this table, this is kind of a very simplified, again, the PMF. Just to be able to give it a little bit better meaning, there is a way how we can diversify the expected results. Usually at the bottom we have activities. Now this is also very specific for the Canadian government. Each donor kind of defines these levels with different terms, but in most cases it means the similar or same thing. So we have activities, and for Canadian government they basically flip into the outputs, which are completed activities. Then we go to the higher level. For the completed activities, it is expected that you will fully cover them, 100% achieved of the completed activities. The completed activities link directly to the immediate outcomes. Immediate outcomes are sort of like a change in the knowledge of our recipients of the target community groups or communities or individuals. So what we want to see is that people think differently about what your message, what the information that you, or the change that you try to achieve in your project. So for example, in our case, people will have idea how to access properly vegetables. For example, they will go through the training for gardening, and also they will have idea how to cook better. The higher level, so all the immediate outcomes will link to the intermediate outcomes. Now, at the intermediate level, we are looking more at sort of behavioral change. So we are not only happy about that the people know about the ways they can access really good nutritious foods, but we are looking at do they actually access it? Do they actually eat it? So we really want to see the results of their actions, and we really want to measure how is their life improving. And then Canadian government also has the ultimate outcome. that could be the big goal of the project that we aim to contribute to. This is really the bigger picture. At the national level, we can look at the statistics and something like that. What I think is really important is that at the intermediate level, we don't necessarily need to cover it fully within the scope of the project. We may significantly contribute. This really will depend on the scope of the project, on the type of and the topic and the focus that you have. But at the output level and immediate level, it should be 100% in our control that we actually can achieve it. So in the previous slide, we talked about the monitoring framework or the measurement framework, PMF, which kind of defines us really how we are going to track that we will be there. We also talked about M&E systems and M&E concept or framework. But there is one more step, M&E plan. That usually comes in at the beginning of the project when we try to do implementation planning or we already have done the implementation planning and now we try to decide how we are going to measure it. So the PMF will help us significantly to know what we need to measure and how. But the monitoring plan should tell us more like who is responsible for it, what will be the frequency, at which event, how we are going to exactly monitor each activity, and also looking at each higher level, that means intermediate or immediate outcomes. Now, do we really need to plan for it? I've seen a lot of projects that they kind of take M&E as something add-on to the projects that we have to do because the donor requires us to do some monitoring and because we have to provide these reports, so we need to have some sort of monitoring. I think that's actually kind of wrong approach. I would suggest that the M&E should be really part of the implementation. I'm not really happy about the way how M&E and implementation is structured in many cases in a field, that we have a project manager and then we have an M&E officer, and they don't really communicate together well about how each activity is going to be measured. In most cases, it's the M&E kind of trying to catch up on the implementation team and trying to find out how am I going to measure it now that when it's implemented. Ideally, these two approaches, the implementation side and the monitoring side, should really come hand in hand and ideally should be conducted by the same people. So that's where I feel planning for M&E is actually really important to do at the same time as planning for the implementation of the project. So try to integrate M&E planning into your implementation plan. And as I say, the monitoring is really key and integral for a project's success, and it's therefore important to plan early. And I believe that the planning for monitoring helps clarify project objectives, assumptions, and indicators. In fact, in many cases, we try to prepare the project design, then we look at the M&E side, how we are going to measure it, and we have to go back in many cases to the project designs and logic models and change the statements, change the indicators in a PMF, because we just figure out that we don't know how to actually measure it when we implement the activity. So again, this should be a living process when the things are being changed. Of course, it becomes difficult if you try to change something throughout the project. So more time we spend on M&E planning at the very beginning, it will save us a lot of time and trouble down the road. It's also critical to have systematic approach to M&E, but at the same time in a way that it doesn't consume super extra time to the team to do. And as we mentioned before, is really handy if the M&E is actually participatory. So why to do everything on your own if you can actually engage the community in measuring their own achievements and approaches? Now that comes with lots of difficulties, but in many cases it's rewarding. And in fact, I believe that thinking about monitoring should start already when we try to do the problem identification already during the needs assessment, because we should be only intervening in a way that we are able to measure it. So sometimes we feel that some intervention is really critical, but if we don't know how we are going to measure that the intervention is going to work, we should just maybe avoid it, because that means that if we are not able to measure it, we may not also be able to achieve the results we aim for. Okay, so let's look at a little example. We trained 25 people in kitchen gardening. We know we trained them, we have the training records. We also drilled 5 wells, so now we believe that the malnutrition rates should go significantly down. This is what we see in many projects, that there is a heavy focus in monitoring on activities, which is great, and it's important. We need to be able to prove to the donor as well as to the community that we have achieved all these activities. But does it really come, can we really expect that just by completing the activities, we will actually contribute towards our higher goals, which means, in this case, reducing the malnutrition? Well, yes and no. We hope that our project design is correct, and we hope that by covering all these interventions, all these activities, that we actually achieve the change. But without knowing and without having a system in place that will regularly tell you, are we actually getting better? This assumption may be actually really challenging. And that's where I think we need to have very detailed monitoring plan, which will tell us how to measure it and how to measure it at each stage. And it's true that in some cases the projects are even too short to be able to see the achievements and the results at the higher level. But at least we should try to aim, and we should have the tools in place and the measures in place that can influence us throughout the project. Any sort of monitoring of the higher level of the change in knowledge and change in behavior of people, sometimes in reduction of diseases and reduction of malnutrition or increase in food security. These measures should tell to the project managers and the project team if they are on the right track. Because in some cases, in fact in many cases, maybe mid-term, halfway through the project, we have to actually decide to change slightly the intervention, because maybe we figure out that there is another factor which affects the malnutrition in this case, and we just didn't respond to that at all. The monitoring and evaluation plan may include, and I mentioned it already in the previous slides, basically we want to look at the indicators, also the outcome statements. We want to look at the methodology. For example, are we going to collect it through household survey? Are we going to collect it through activity records, through focus group discussions, interviews, pictures, or any other ways? What is the purpose of the collection of that specific information? Is it only for linking to the report, or is it also influencing the implementation? Are we actually expecting that the change will be happening already during the project period? We should also try to place the frequency and in fact the usage where this number will be linked to. So which reports or which tool we want to use these results in. Okay, so let's do some recap on M&E plan. I think it should be a teamwork. Involve as many people from your team in the planning for M&E as possible, from finance to field team to technical experts to PR people. All these will have something, I'm sure, to contribute to the M&E plan. Try to integrate the M&E plan as much as possible in the activity and implementation planning. Because if you are implementing activity and you already know how you are going to monitor for it, how you are going to monitor its implementation, it will significantly speed up the whole work. But also try to integrate higher level outcomes in sort of measurements. Let's say a household surveys can be done really nicely together with some other in implementation when you invite, for example, people for a training to the one location. The implementation plan should be very clear and realistic. If you make it too complex, too long, with too much information, there is a very low chance that somebody will actually read it. Once the M&E plan is done, it should be shared across the team, but also it may be a good idea to be transparent and share it with our stakeholders, and maybe in some cases also community representatives. And to keep everybody on board and also to kind of keep the M&E plan on top of our minds, it's not a bad idea to review it regularly. Now, that depends on the scope and the time frame of the project. It could be a quarterly, it could be annually, or for longer projects it can be less than that. But assigning a time that when whole team actually meets, and it could be a team in the field and a team in Canada as well, or elsewhere, will actually help you to stay, do it, and keep the plan, keep the M&E plan updated and relevant. Okay, now when we talked about M&E planning and performance measurement framework, the key part of all this are indicators. And I'm pretty sure that in your experience, in your career, you probably worked with some indicators. Let's maybe unwrap these indicators and let's think about what we actually mean and how to make indicators strong and relevant. If you open any internet resource or any M&E publication, I'm pretty sure that you will see that your indicators should be SMART. Now, the SMART acronym has several ways how to interpret it, but it could be something like specific, measurable, appropriate, relevant, and timely. But how to actually make them SMART? Let's look at a couple of examples and let's try to find out some mistakes that we commonly do in defining the indicators. Okay, so indicators should be specific. What do we actually mean by saying that it should be specific? Well, for example, it should at least focus on one thing, measuring only one thing. Why is that? And we try to squeeze too many things in one indicator, and sometimes we have no other options, especially when we are limited on number of indicators that we can use, or some indicators may be very closely tied to each other. The issue and the challenge we may have with that is if we may not see the results we expected to see or we assumed we will see. The issue is that now we don't really know, unless we dig deeper, if it's because one thing or other. So let's look at this specific example. Percentage of mothers eating and feeding daily their under 5 years old children balanced diet in adequate quantity. So we have compacted so many things in one indicator. So first of all, we are looking at balanced diet and adequate quantity. Now, in the food security sector, this can be called minimum adequate diet. It may be okay, and I think this indicator is actually still under the review of international community if it's the right indicator we should be using. But at this point, it's commonly used indicator. So not only we are looking at two things at the same time, is it a balanced diet, which means a good food diversity, at least 4 food groups in 24 hours. We also are looking at the quantity of food, which means, for example, anything between 2 to 4 feedings, maybe add to breastfeeding to that as well. So if there is no clear number, if let's say the result is not what we expected, we don't know if it was because of the balanced diet or because of the lack of the quantity. So we are not sure. We need to dig deeper into the questions and results for each question. However, there is another duplication, and that's when we look at the percentage of mothers eating and at the same time percentage of children being fed daily, this adequate diet. So to make this clear, I would recommend doing this indicator percentage of mothers eating daily balanced diet in adequate quantity, or percentage of children or percentage of mothers feeding daily their under 5 years old children balanced diet in adequate quantity. Again, ideally, we should only look at one thing at a time, so it could be percentage of mothers eating balanced diet and percentage of mothers eating in adequate quantity. But currently in the food security sector, these two things are commonly brought together in one indicator, so we can call it a minimum acceptable diet. But I would highly recommend separating the mothers from children in this case. Okay, so in the next step, let's look at measurable. So we want to have all indicators set in a way that we are able to measure them. Now, we have example here, percentage of children under 2 years old consuming year-round balanced diet. So let's check it if it's specific. We are looking only at children under 2 years old consuming year-round balanced diet. Balanced diet is represented by food diversity, so at least 4 food groups in 24 hours. So that it's pretty specific. It looks at only children eating balanced diet. However, can we actually measure it the way it's written here? Because in reality, this would mean we should be asking children, are they eating the balanced diet? So I feel this may be quite a challenge, measuring and asking 2 years old children, what do they eat? So maybe instead we would want to say percentage of mothers feeding their children under 2 years old balanced diet year-round. So instead of looking at the children actually eating it, we may be looking at mothers feeding it to the children. It's a small difference, but it makes the indicator clear and measurable. Another part of our acronym, SMART, is A. I really like the word acceptable. In many different publications, you can find different ways what should be the A, but I really like acceptable for one reason. I believe that with our M&E we should be very transparent, and the M&E should be participatory, as we talked about several times. And so acceptable to me means that it's accepted by the donor, but it's also acceptable by the community members or people who are kind of the objects of the indicator. So let's look at this specific example. Percentage of community health workers failing to conduct monthly growth monitoring sessions. It's very specific, it's measurable, because we can measure how many children were screened at each location. To me, it seems as an okay indicator. But now, do you think that this indicator would be actually accepted by the community health workers if they know that we are measuring the percentage of health workers who fail to conduct it? In many countries, this is a mandatory service that once they commit to it, they have to fulfill it. So my suggestion would be to measure percentage of community health workers performing monthly growth monitoring sessions. And that actually, just by changing it into the positive statement, we basically measure the same thing or the reverse thing, but it will be much more acceptable in the community when we present the results. Another letter in our acronym SMART indicators is R, relevant. I believe that this is one of the most important factors when we try to look at the indicators. The last letter in our acronym SMART for indicators is time, T, time bond. It is really important that we specify in the indicator for how long, for which period, or what frequency, for example, something needs to happen. So let's look at this concrete example of the indicator that we have here. Percentage of women in reproductive age eating iron-rich foods. So now let's pause for a second. When we look at the indicator as it is, I would suggest that in reality, in the project, we would want to define very clearly what is iron-rich foods in each context of your project. So let's say if your project is across different areas or different countries, the specific examples needs to be very context appropriate. So that's just one thing, but let's leave that for on a side for a while. What is missing in this indicator is the time. So we don't know if we are asking the woman if she has eaten any iron-rich foods over the past year, ever in past 24 hours. So that's what is actually missing. And I would suggest that this indicator could be significantly improved if we would say something like percentage of women in reproductive age eating iron-rich foods at least once in the past 24 hours. That makes it very clear and very specific. Another reason why we should have really clear time frame about the data and the indicator is that we really want to tie the results of the project to the actual project. So in many cases, we will limit the duration of or the period of focus. We can limit for the duration of the project in the past year, in the past 2 years, or something like that. Whatever makes it specific enough time frame, or whatever gives us this specific time frame that is relevant to the indicator. And my last recommendation for you regarding the indicators is that in many cases, it's true, others were there too, and you may have an example of the previous projects with amazing indicators that you just decide to recycle and reuse in your next project. It's great, and you may find really good compendiums of indicators online, or you can get some tips from your colleagues or donor. However, this comes with a big trade-off. So it may be a great inspiration, and we highly recommend using any of these compendiums or standard indicators. In many cases, they are very well designed and can really help us to measure what we need to. In many cases, we try to discourage our partners from creating their own indicators because they may not work. However, what I want to really emphasize on is that in many cases, reusing or using indicators from some of these sources may lead to really poor specific connections and ties to your outcomes. So before you reach out to any of these compendiums, my suggestion would be to try to come up with the indicators, or try to because if you do it on your own, it will actually help you to identify which kind of indicators from the common indicators or compendiums you are looking at, or you should be looking at. Alternatively, you could also just pull the indicators from these sources, but make really sure and do the back check that they actually clearly link to the outcomes and outputs that you need to.